I'd
like to call to order the Monday, September 14th, 2020 St. Lawrence County Board of Legislators monthly meeting. I'd entertain a motion to suspend the rules by Mr. Fay, seconded by Mr. Forsyth. Any discussion? Seeing none, all in favor?
Aye.
Any opposed? No opposed? Roll call, please.
Reagan,
Here.
Forsyth,
Yes.
Lightfoot,
Here.
Sheridan,
Here.
Smithers,
Here.
Denisha,
Here.
Perkins,
Here.
Akers,
Here.
Tay,
Here.
Haggard,
Here.
Piacco,
Here.
Burke,
Here.
Arquette,
Here.
Terminelli,
Here.
Curran, here. 15 present.
Thank you. If everyone will stand, we'll have a prayer followed by the Pledge of Allegiance. Mr. Denisha?
Mr. Chairman, I would ask for a moment of silence for the victims of 9/11. Thank you. Dear Heavenly Father, this evening we thank you yet again for the opportunity to gather in your sight. May you hear our prayer and be gracious to us and bless us, individually and as a nation. May you grant us understanding and courage in our actions and deliberations. May our faith in you and one another grow beyond our doubts. May you bring us together in unity of purpose. For a moment, let us reflect upon the words of Ralph Waldo Emerson, and I quote, "The purpose of life is not to be happy, but to be useful, honorable, and compassionate, and to have it make some difference that you lived and lived well." All these things we ask in the name of Jesus Christ, through whom all things are possible. Amen.
Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. For a motion to approve the agenda by Mr. Denisha, seconded by Ms. Curran. Any discussion? John, did you have your hand up? Mr. Burke? You're muted. I guess not.
No, I was muting.
All right, thank you. Okay. All in favor?
Aye.
Any opposed? I'd entertain a resolution, to move for the approval of the minutes of the August 3rd meeting.
So
Mr. Sheridan and Mr. Perkins. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. We'll have a COVID-19 update by Dr. McGuire. You're muted, Dana.
Hi, everyone. I think Dr. Williams is going to share his screen and I'll talk first and then he'll kind of do the last part.
All right, go right ahead.
Okay. So as of right now, we have 305 cases. 3 weeks ago, the last time I did a report for this meeting, we had 264. So that is quite a few new cases just in the last 3 weeks. We currently don't have anyone in the hospital. We have just 7 of the active cases that we do the monitoring on a daily basis. We have 294 who've been through the isolation process. Still, we are at 4 deaths. We haven't had any new deaths since about 2 months now. Just as a reminder, these are the testing sites for the county. So should you know anyone who wants to be tested, please pass these phone numbers out. You do need to call for an appointment first. And so this is just the numbers just to call. And you have still the testing on the weekend as well, and that's done by the urgent care in Potsdam. So I just kind of like to show the trends we've been seeing since the response started. And so you can see each month just like how many cases we've had, how many of the hospitalizations we've had, and then like each month for the deaths that we've had, and then the amount of people who have been put just into the quarantine process. And that's for those who have been exposed to a positive, they've been a traveler. And so you can see when we started out in the first month, we had quite a few of those just in the quarantine process. We went back up last month due to the travel advisory, and you can see that we're kind of coming down. We're not seeing so many of those kind of travelers. And the people who have been in the mandatory quarantine due to the exposures to a positive have been less. And particularly in the mid weeks of last month, we had no positives for just a while, which meant then for a while we had nobody who was in the mandatory quarantine. Next. So this slide just shows a nice comparison of where we were for the 3 months of the summer. So at the first of each of these months, it shows just how many cases we had since the response started, who was in the hospital on that day. So we just had 1 hospitalization for last month. And at that first day of those months, just how many people who had went through the isolation process, where we were with the deaths as we moved forward through the response, and then where we were kind of getting the cases from. So you can kind of see from what we had in those 3 months, we've kind of changed from the essential workers being the testing due to the nursing homes, to the screenings that people had to get done due to travel, doing testing to be back at school and those kinds of things. So you can kind of see the changes over those 3 months. Next slide. And then so far for this month of September, on the 1st, we were at 273. And as a summary for the cases over the month so far up until this date, we've had 32 cases. We've had 2 hospitalizations. 6 of the cases have been asymptomatic. And the types of cases that we're seeing, or why people got tested or why they've been positive, has still been due to the medical types of the procedures. We've had 3 of the college staff or students just during this month. We've had 6 positive cases due to the essential testing. And we've had just 20 cases due to a cluster. So we've been talking about this cluster. So this month, there's been 20 cases, but there's been 20 cases since the beginning of this cluster. And the cluster we've seen has been due to a work site, due to spread to the family members, and then due to some types of the gatherings that we've seen in the area. Most of the people that have been in this cluster have had signs of symptoms that look like a sore throat, kind of like just a runny nose, and some of the congestion. So as the response has moved through the months, we've seen some of the just some of the different kinds of the symptoms that you could see. Now, not all people have these, and there is just multiple symptoms due to the virus, but those are the main ones that we're seeing right now. Next slide, please. So here is the curve that shows the cases we get on a daily basis. So this just shows since the very start until right now, where you can kind of see the ups and downs. And so in the first few weeks of September, we have had a rise in the cases again. Next slide, please. This shows our cases on a weekly basis. And right now we've had 9 cases this week so far. Our week usually ends on a Tuesday. For the previous week, from 9/2 to 9/8, we had 22 cases. And for the week previous to that, which was 8/26 to 9/1, we had 10 cases. So you can see that that about 2 weeks ago was when we had this rise. If you go to the next slide, it just shows what we've had as like a daily average. We're back down to just over 1 case per day. But about 2 weeks ago in that week, we were seeing just over 3 cases per day. Next slide. For the cases by age, you can see we still have the 3 main age groups. During the past week, the average age has been about like 30 years. 2 weeks ago, it was about 40. So we're just kind of around that age group. Next slide, please. We've stayed with the same ratio with respect to sex. So it's just about kind of half and half, with the females being slightly more. For the people who have been through the isolation and the quarantine process, we currently have those 7 people that I mentioned that we're monitoring due to isolation. So those are the people who have tested positive. We have 125 in the precautionary quarantine. So those are going to be the people who have been put into quarantine due to the travel. And the 100 and the 56 is due to those in the mandatory quarantine, or those who have been exposed to a positive. We've seen just over 3,500 who have closed the process. So altogether, we have about 3,800 who have been through the process or who are in the process now. With the travel advisory, the states get updated on Tuesdays. So this is what we are currently seeing. They kind of go back and forth. We usually lose a few states and we gain a few states. And so if you're going to be traveling from these states, there is a form that you are to fill out so that you can go through the quarantine process. For the updates for our department, we've been doing the gym inspections now for about 2 weeks. We've been through 14 of the inspections, and we have just 2 pending right now. They've all went kind of very smoothly, and so things have been going well with that. We continue to talk to the K-12 schools and to provide some of the guidance. There should be new guidance coming out from the state on a few items. So we've been waiting for that for a few weeks now. So we're just really hoping that those kind of documents do come soon. There is a new executive order that schools do need to report on a dashboard, just how many of the cases they have at school. So we're just working with those and trying to help the schools just to get that information. We continue to work with the colleges. We meet on a regular basis to help them through their cases, to talk about things that are going on, to make sure that the students who are in quarantine or that are in the isolation process do have what they need. But in seeing the reports that we see just around the state, I feel pretty glad that we do have the conversations and the communication that we do with the colleges. That's been one of the lessons learned from some of those who have seen cases, that they haven't been able to get the test results and talk back and forth with the schools. And so that is something that we do just on a weekly basis. We are also providing vaccinations to school students. So though just many of the students are back in kind of like at home or may not be at school, they still do need to have all their shots in place so that they can just do all the classwork that they need to do. So we are just setting up vaccinations for those students who could not see their provider or who could not get an appointment. So that's what we have going on for our department, and I'll just end. These are the 5 recommendations that we still have. So we've been talking about these now for quite a few months. And if you hit it again, please, for me. These 2 things are what we're seeing the most in people not doing and why we get the cases that we do. So it's really just to wear a mask and to stay home if you're not kind of feeling well. In some of the cases that we've talked to, there's been kind of symptoms. People go out, they go to work because they don't realize it, but like the symptoms that I had mentioned that people have when they do become positive, you know, they are things like the common cold and some of the other things. So just be aware of how you feel just on a daily basis. Okay, I think I'm done now. Thank you.
Okay, thank you. Dr. Williams.
Good evening. So I wanted to, first of all, thank Dana and her team for all their hard work. This has been going on for quite some time and they keep working hard. I did want to just start by kind of talking about national trends because I think ultimately they end up impacting the North Country. So if you look at what's happening in the US, we went from a tough month in July with about 75,000 new cases per day at the peak, down to 35 to 40,000 new cases per day in the month of September. As far as the death trends, we had a peak of about 2,000 deaths per day at the greatest. And then we've decreased to about 1,000 per day, somewhere between 750 and 1,200 deaths per day. When we're looking at that national trend, they're generally favorable, but I think it's important for us to keep in mind that there's some changes that have happened in terms of testing. So if you look at the 9 high-risk states that currently have increased numbers of COVID cases, the testing pattern is different in each of those states. So this is some data from Johns Hopkins. They looked at the testing and found that in 7 of those 9 states, despite the fact that they have an increased number of cases and a typical public health response would be to increase the amount of testing, in 7 of those states, they're actually either decreased or have failed to increase the amount of testing they do. And only in 2 of those states did you actually see the appropriate increase in testing. That would be the normal public health response. So looking back at what looks like a favorable trend in the US, I think it is a favorable trend, but we have to keep in mind that the only way we identify cases is through testing. As far as regional trends in the North Country, as we've talked about back in March and April, we got up to 3.5 new cases per 100,000 residents. We had a little bit of a tough July and end of August. This is as a region, but right now the region has gone back down to somewhere around 1 new case per 100,000 individuals, which is favorable. And as far as testing, what you see from this graph, and these are both from the New York State early warning dashboard that is supposed to give us guidance about what's happening in our region. What you can see is that the percent of positive tests, which is that sort of orange line, had been quite high early on. But then as testing has picked up, which is represented by the vertical blue lines, the percent positive has gone down significantly, which is what you would expect. The next thing I want to mention, because it's been a topic, is the colleges in our area. And as Dana said, the colleges have been exceptionally cooperative with the Department of Health, with the Board of Health, and I think with the county. And they've really made tremendous efforts to try and keep our community safe. You know, we look at the national news and you see some pretty alarming numbers from college campuses. And even within New York State, not too far from here, there's some college campuses that have had quite an abundance of COVID cases. Fortunately for our colleges, despite a large number of students tested, as well as staff, and some of these students have been retested and some of the staff have been retested, we really have only identified between students and staff 2 cases at each of the respective campuses. When these cases have been identified, the colleges work very, very closely with Dana's team, and we've been able to appropriately isolate or quarantine people. And so far, we've done really well. And I think, again, this is, reflects the hard work that the colleges all put into this and the fact that they've worked so closely with the department and the Board of Health. If people are interested, one of the things that we've always talked about is the importance of transparency throughout the whole, public health crisis, but also with the colleges. So the colleges have each created their own dashboards that give updated information about the testing that's being performed, also about the number of people who've tested positive, as well as the number of people who are isolated or in quarantine. The SUNYs, both Canton and Potsdam, have their own dashboards up here. There is a SUNY-wide dashboard that one can also access. But if anyone's interested, you can take a look at this. And again, this is in the spirit of transparency, and it's really reflecting the hard work that the colleges have all put into this. So K-12 reopening has been another thing that I think everyone's been thinking about and concerned about. As you know, we have approximately 15,000 students in the county. All of the districts at this point have reopened either with hybrid programs or online. They've all made huge efforts to open in as safe a manner as possible, with screening, with environmental modifications, and also with enforcing masking recommendations. At the outset, all of the school districts, with the exception of one district that Dana alluded to before, were in the green zone. If you remember the table and the white paper that I mentioned at a previous presentation, the Harvard Global Health Institute put out very important information, I think, about how to assess the COVID risk level, and then what appropriate strategy should be implemented for school. It's a little hard to see the table on the right. If anyone had any questions about that, I'd be happy to send that to them afterwards. Part of reopening is really, again, an example of a collaborative process where public health, the teachers and administrators, the medical community, and the school nurses have all worked together really to focus on the safety of the students and the safety of the families and safety of the community. A couple of specific things I wanted to mention about what the medical community has done. In coordination with the Department of Health, we created a pediatric COVID response team. So this is a group of nurse practitioners and providers who are able to answer a hotline, especially for school nurses who have questions about what to do with pupils who may become ill. We also established a COVID pediatric urgent care, which is right now based in Canton. This is not to replace the amazing care that family doctors and primary care doctors provide, but it's a specific resource so that if a student does become ill and a school nurse or a primary care provider feels like this is a resource they want to take advantage of, there's access to rapid testing if it's deemed to be appropriate. And that's a critical factor for some of these students who really want to return to school. And as I mentioned, there's a support hotline for the school nurses. So throughout the day, the school nurses, have students who are coming to their offices and they may have questions. Some of the questions are public health questions, but many of the questions are about what are the next safest steps for that student. and this hotline is there for them. So we just rolled this out at the beginning of school, but each of these different measures has been well received. I wanted to give just a general update on testing. As you can see, if you look at the New York State website for our county, we've done more than 50,000 tests. PCR, either done at the testing centers, done at the workplace, or done on the campuses and sent to the various reference labs, still represents about 95% of the cases who've been tested, of the individuals who've been tested. So this is people from the general public. It's the mandated screening of essential workers, in particular nursing home employees. And it's also screening of college students. There is rapid testing, either molecular or PCR, which is done in the different emergency departments, both the ones run by Claxton and by St. Lawrence Health System. And some of the urgent cares are able to do this. And again, it's on an as-needed basis. And a question that comes up for everyone is if the molecular PCR rapid test is available, why can't everyone have it? And unfortunately, it's really an issue of a lack of inventory. So hospital systems are trying desperately to get more of these rapid, accurate tests. They're simply not available. I'm hoping they'll become more available as the year goes on. We've talked about antigen testing. That's another kind of rapid test. Some local private practice providers are offering this, and one of the private urgent cares in the area is offering this as well. So this is another rapid test. There's still questions about the optimal utilization of this. It's clearly appropriate to use this for somebody who's symptomatic. So this would be a good option, for instance, for a student who had symptoms. But there's still questions about the appropriate use of this in asymptomatic individuals. There's been some information in the literature about using antigen tests, which are less accurate, less sensitive for people without symptoms. But all of the research on that is based on the idea that you're going to test people frequently. The problem is antigen testing is just as hard to get as the molecular PCR testing. So there's really no opportunity to frequently test people with the antigen test at this point. I did want to mention that the saliva or pooled testing is being done by the SUNY systems. It's now, I believe, going to be done on campuses. This does use PCR technology, but the collection sample is different. It's saliva, and it's collected and put into a pool. You can still test the individuals if the pool is positive, and it's a very efficient, economical approach. I also wanted to update people about wastewater surveillance. So I've talked about that a number of times, but that's an opportunity to look at an entire village, an entire city, possibly a campus or a residence hall or a nursing home or a school, and see whether there's any evidence of COVID in the wastewater. It's been used in polio research in the past. It's being used across the country now for COVID, and it's probably the most economical approach. And Clarkson has just started doing this on their campus, and they're working with St. Lawrence to do it on their campus. And we're just talking in a preliminary manner about being able to offer this to other organizations in the community. The K through 12 schools may actually be an excellent application for this, since we're not testing individual students, we're not screening individual students, but this would be a way to essentially screen an entire school. So this is preliminary in terms of putting it out in the community, but Clarkson does have the ability to do this. The SUNY systems are doing it through their own SUNY system, but I'm hoping that we can have some conversation with the local schools, and then possibly some other opportunities to use this very economical and sensible technology. So that's my update. If anyone has any questions for either of us.
Does anyone have any questions for either Dr. McGuire or Dr. Williams?
I do.
Hang on, we're trying to get your photos up. There we go. Okay. Ms. Haggard.
Thank you, Mr. Chairman. My question is for Dr. McGuire, and it's kind of two-part. First of all, I'm wondering if the Department of Health is fully staffed right now, and do you anticipate that you're going to need more people, given that we're headed into flu season and a lot of trends that I'm starting to see in my own community, but I'm wondering what your take is on that. Do you have everybody you need, or do you need more people?
So we currently have 4 vacancies. 3 of those are in nursing staff. So we are working hard to do all the case investigations, and right now we are covering that. But with season and with vaccinations for back to school, we are asking for assistance from the community. So we do have that kind of going on right now. It'll be difficult to say with the flu season. We are going to do some of the promotions. We are going to try to hold some of the flu clinics. We do have grant funds to pay for external assistance just to help us, but we need to fill some of the positions that we have open in the department.
And what are the holdups on filling those positions? A lack of applicants? What's the problem that we have 4 positions open during a pandemic, heading into a rough time of year?
One is that the load for the EI program, which is the 0 to 3 age group, that continues to rise. So that we're going to vacancy for now. One is for a nurse position that has been open. We just haven't found kind of a candidate that fits the position. And some is just during leaves. So we do have some of the temporary areas, but we do have needs to ask for more temp roles because of just the workload that has went up right now.
Thank you, Dr. McGuire.
Okay. Go ahead.
Tony.
Go ahead, Tony.
Oh, thank you. Doctors, since the onset, certainly you've encouraged anybody that's symptomatic to get in and get tested as soon as possible. And we know, since then that this virus attacks the respiratory system. My question is if somebody is asymptomatic to what they understand for COVID, but they begin having symptoms that are respiratory related, for example, pneumonia per se, should there be an assumption that there's a correlation there? Or if somebody has never had pneumonia, they suddenly have it, is it likely that the COVID was there first?
Yeah, I'll handle that. I think, certainly people with COVID do end up having pneumonia oftentimes associated with, so they have changes in their lungs that are consistent with pneumonia due to the virus itself, and then also due to the inflammatory response from the virus. We still do see people with good old-fashioned pneumonia from other viruses and from other bacteria. So that hasn't gone away. We do occasionally see somebody who has a confirmed infection with COVID who then gets a second separate infection that is probably related because the patient was, ill with the COVID virus. So I'm not sure if that answers your question, but we still see regular pneumonia. People with COVID, especially the ones who end up being hospitalized, do often have pneumonia as part of the presentation. It's not pneumonia in and of by itself. There's other symptoms associated with it.
Mr. Chairman, if I could just follow up.
Go
So
ahead.
would you encourage people that do have respiratory symptoms, but they don't recognize COVID symptoms, to get tested as soon as possible?
Absolutely. And I would consider any respiratory symptom to be a COVID symptom. So cough, runny nose. And the challenge, of course, is in the North Country with our haying season. I mean, grasses, people have runny noses. And I think what we find is that some people have pretty mild symptoms. Fortunate for them, unfortunate for them and everyone else, some of those people have COVID. So it's very tricky. But yeah, any respiratory symptom, cough, shortness of breath, fever, which are symptoms of pneumonia, should prompt somebody to seek medical care, and the sooner the better. And in the meantime, it's very important that people self-isolate if they don't have a test back, and especially if they go to get tested. One of the other patterns that we've seen, unfortunately, is people occasionally have symptoms, get tested. There is this unfortunate short delay to get the results. But in the interim, people really should be self-isolating. They should not go to work. They should not be around others. They should self-isolate and treat themselves as though they have the infection, which I understand is a burden, but it's a much bigger burden if they had the infection and they gave it to others.
Thank you very much. Mr. Chairman, just one more quick one if I could.
Go ahead.
The 8 cases that you outlined for the universities, the 8 positive cases, and I know, Doctor, that you mentioned this before, but just to refresh my memory, are those cases, I hate to say the word accredited, but are they outlined within St. Lawrence County or the place of residence of that particular student?
Dana, do you want to answer that?
Well, I can answer that. So at times it's going to be difficult for us. So the colleges will always have an accurate number of their cases. They have to report all of the cases on their campus. Like I've mentioned previously, it really depends on the address that goes in on the test. Most of our college campuses, though, are testing locally. So most of the addresses, most times. So we have not had yet a case that we've not been able to report. But there may be times where the colleges are going to be off from what we have based on what we think is a college, but the colleges need to be transparent. And the fact is we will know about all of the cases because the college does tell us, but how we're counting cases for the county, it's going to get a little weird because if their address is not here, there is another county that's kind of counting it. And while it may get transferred to us, that state system might not pick it up. So there is a little bit of weirdness. And so with that newest the executive order that came out for the school dashboard, that does include, it includes the colleges as well, but we're going to start with K-12. And so, but that is still the colleges doing the reporting. And so I'm not sure if that's going to be different than some of the dashboards that you saw just here now, but we're trying to make sure that there's transparency, but there is a little bit of it's going to be hard sometimes to be on the same page.
Thank you both and your staff for all of your hard work throughout this. Greatly appreciated. Thank you.
Mr. Burke.
Dana, just a follow-up on Margaret's question. Just to assure that we have the resources needed, should there be an uptick in reported cases. I mean, your department has done a fantastic job, but with what Dr. Williams has just stated, that the testing for people who have a cough, who have any respiratory symptoms, I guess I'm just wondering if going into the fall season, if we should anticipate bigger demands on your workload and plan for that so that you do have the resources needed. Would you mind commenting on that?
Sure. So I think you're right. So we did fill 2 temp roles. We do have some of the other county employees who are helping with contact tracing. So we're able to just have them. And so that's been great. We've been getting assistance from all the departments. It's really hard to plan for. With the caseload going up and down, how it has, we're trying to manage. But I would say that during the flu season. We're also trying to manage just being able to provide that, to do the back to school shots that we need to do. And so there's a lot of demands, and because through the summer, the caseload went down, we had stopped many of the other programs that we do, but we have ramped those back up, and there are some that just never stop. And so we're doing a balance of trying to carry the workload of things that always happen, plus carry the workload. So I am going to the vacancy. That's where I think tomorrow. And, so we will talk about that. I will talk about the extra help that we've been getting, what we need to do for the contracted type of the employees that we have. And so it's just, we always have to have a rationale for what we need. And right now, we don't know what the caseload is going to be. I will talk to the committee and see, what we need to work out. For case investigation, mainly it is a nurse. Now, you don't need to be a nurse. You need to know how to do an interview and things like that. It is very difficult to find staff and to, get those are the positions that we have the hardest time trying to hire. So I guess if you can get that word out, that would be helpful just for us too. We do have grant funding to pay for the temporaries, to ask for the extra assistance. So should we not get a full-time, but we can get people in to help and do that stuff, we can pay those, but it's very difficult trying to find those staff.
Is there anyone else? Ms. Curran.
I don't have a microphone, so I'll try. I noticed that Dr. Kelly, and I sent a copy of this video that Dr. Kelly from the St. Regis Mohawk tribe put up about 2 days ago. I sent a copy to Dr. Williams. He goes through every conceivable situation that we have. Is it a cold? Is it the flu? Is it just a regular respiratory virus? Do you have to think about COVID? These are the things that you need to have at home now, and think about being able to treat yourself. These are the temperatures that you need to look at. If your temperature's over this, you really need to think about COVID testing. If you have these symptoms, you really need to have to think about COVID testing. As soon as you become sick, you should isolate. You should not go home or not go to work. You should stay at home. You should not do this. I thought it was a good video. I'd be interested to see, Dr. Williams, what your thoughts are on it when you get a chance to look at it. But maybe we have Dr. Williams come up with something like that, or share that video if you approve of it. But it would be nice to have something up on the county website that gives some kind of a preparation. Like, now would be a good time for everybody to make sure that they have Tylenol tablets, liquid at home, because they're really not recommending Motrin to people who might be COVID positive. And we're trying to stay away from it. Crackers, rice, things that people could eat if they are sick. And whether it's the COVID virus, the diarrhea and nausea and vomiting that's going around, or just the common cold, if you're sick, stay home. When you're out in public, wash your hands after you touch things before you eat, before you do other things. I'd like to see us do something like that and have it available to folks.
Thanks.
Any comments, Doctor? Dr. Williams, any comments?
No, but thank you for sharing that, Rita. I'll review it, and we can talk maybe afterwards.
Okay. Anybody else have any questions for Dr. McGuire or Dr. Williams? Seeing none, thank you both. Appreciate your time and the work you're doing, as always.
Thank you.
Thank you.
All right. We'll move on to communications.
A resolution was received from the town of DeKalb in opposition to New York State Senate Bill S8676 and Assembly Bill A10780, which requires police officers to maintain private liability insurance and exclude police officers from provision providing defense and identification. That's all.
Thank you. Now is the time for citizen participation. Any citizen that wishes to address the board is asked to come to the stand. Limit your time to 5 minutes and state your name before you start. Mr. Berry, you've signed in?
Yes. I am Kevin Beery from Colton. Erie Boulevard Hydropower, a subsidiary of Brookfield Renewable Partners, has petitioned the New York State Supreme Court for an approximately 50% reduction in the assessed value of its 6 Colton dams. This comes on the heels of a previous reduction Brookfield was given just a few years ago. The company has also petitioned the court for reductions in the assessed value of its assets in Clifton, Parrishville, Pierpont, and Potsdam. The law firm representing Brookfield is the Syracuse firm Barclay Damon, which counts among its attorneys 3 powerful New York State legislators, Will Barclay, Assembly Minority Leader, and Senators Neil Breslin and Tom O'Mara, both of whom are members of the Senate Ethics and Internal Governance Committee, which body could prohibit legislators from receiving outside income, but which to date has done nothing in this regard. Barclay Damon also has a subsidiary, Empire Advocates, which specializes in state and federal lobbying and declares that the secret to successful lobbying, quote, isn't what you know, but who you know. Empire Advocates has the connections to help get the job done, unquote. Brookfield can well afford to avail itself of one of the most politically connected law firms in the state. According to its latest earnings call, the company's cash flows are highly resilient, and we believe the prospects for growth of our business are better than they ever have been. Brookfield's hydropower stations are characterized as perpetual assets, which form part of its perpetual hydro business. Lucrative hydroelectric dams are indeed the bedrock of Brookfield Renewable, and their value in New York State is poised to increase even further under Governor Cuomo's Climate Leadership and Community Protection Act, which requires that 70% of electricity consumed in the state come from renewable sources by 2030. The company's strategy is clear. Demand reduction after reduction until it gets the assessed value of the dams down to 0. So that the riches it realizes from its exploitation of the waters of St. Lawrence County can be booked as pure profit while homeowners pay the conglomerate's property taxes. I urge the St. Lawrence County legislators representing the towns of Clifton, Colton, Parrishville, Pierpont, and Potsdam to look into this matter and to do whatever they can to protect their constituents from the depredations of Brookfield Renewable Partners. The fact that 2 New York State senators and a New York State assemblyman are employed as attorneys by Barclay Damon, a firm that boasts it's not what you know but who you know when it comes to lobbying government agencies, indicates a clear conflict of interest as concerns Barclay Damon representing Erie Boulevard Hydropower. The St. Lawrence County legislators have been very diligent in preventing any conflict of interest in sitting board members. I hope they will do whatever they can to see that Barclay Damon is disqualified as attorney for Brookfield Renewable's Erie Boulevard on the grounds of a conflict of interest that would not be permitted in members of this county legislature and should not be permitted in members of the state Senate and Assembly.
Thank you, Mr. Berry. Eileen Raymond? Thank you.
Good evening. My name's Eileen Raymond. I live here in Canton, lived here in St. Lawrence County for 28 years now. Last fall, I chaired the Justice for All Conference at the Unitarian Universalist Church downtown, with 120 folks from all over the county gathered to consider a wide range of issues related to criminal justice. At this time in our country's history, I'm finding these conversations we had last fall even more relevant than we could have even imagined. These are devastatingly troubled times in our country, seeing reports of multiple attacks by police or vigilantes on unarmed Black Americans in the nightly news. And these reports do not stop. I'm here today to talk to you about Governor's Order, Executive Order 203. This executive order, entitled New York Police Reform and Reinvention Collaborative, was issued in June in response to concerns about public safety and policing across New York. Following the passage of legislation last spring aimed at curtailing specific police abuses in our state. The resolutions you passed last month relating to policing here in St. Lawrence County did absolutely nothing to address the roots of the problem we currently face in our county and state. Such minor tinkering around the edges of a broken system are not likely to bring our county or state or country together. Executive Order 203 gives us an opportunity to consider what our communities look like now and what all of our citizens need. It requires us to hold community dialogues on what works and what isn't working across our county, and for whom. Although it positions policing at the center of the conversation as that element of our collective life that is currently not working for some in our community, I believe that these issues are not solely at the police station, but more importantly, they are about the mix, functionality, and integration of all of our protective services. Too many of our citizens struggle every day with poverty, drug addiction, discrimination, mental health, and other issues. And too often our police are called to respond to these struggles, tasks that they are generally ill-prepared to address by themselves. Too often we see problem incidents become criminal events and even fatal police interactions. One only needs to look at the recent reports of the death of Daniel Prude in Rochester as an example. No one wants to see that happen in our county. Consider how these outcomes might have been very different had folks experiencing these challenges had access to more appropriate early interventions, and if police personnel had been helped to see other ways to protect and defend all of us. Over the next 8 months, we and you have the opportunity to imagine a different St. Lawrence County. How might it be different if we were to shift some resources and energy away from enforcement and containment to supports designed to address social problems at their sources? If we were to change the way we prepare new recruits for our policing units, including the Sheriff's Department, to use their training to de-escalate conflicts rather than going directly to arrests or sometimes the use of lethal force. My village of Canton has already taken first steps to convene a community conversation here in Canton about public safety within our village. I urge you as county legislators to immediately create a similar listening process for the county as a whole, to bring more voices into the process and making sure that everyone can share their needs. It is your duty to assure that we can respond to this executive order in a comprehensive and timely manner, meeting the April deadline for compliance in the order. Only by hearing from everyone and engaging as many stakeholders as possible in this countywide process of reimagining a better way to assure our safety, our sheriff's department can be made more effective. Through this mandated process, we will create a St. Lawrence County that will better serve all of us in the future and make our county an example of what committed citizens can accomplish when we sit down and really listen to one another.
Thank you, Mrs. Graham. Is there anyone else that wishes to address the board?
Joe, I have one thing I need to read.
Beg your pardon?
I had one thing I need to read.
Please do.
To the St. Lawrence County Board of Legislators, normally Madeline Pennington and Barb McCorney would be here to present the Untitled Chapter of the Daughters of the American Revolution resolution proclaiming the week of September 17th through September 23rd, 2020 as Constitution Week. They have asked me to read the following regarding the resolution about this celebration that was started by the DAR in 1955 when DAR petitioned Congress to set aside September 17th through the 23rd annually for the observance of Constitution Week. September 17th, 2020 marks the 233rd anniversary of the adoption of the Constitution of the United States of America. It is important for all Americans to recognize this magnificent document and to reaffirm the ideals the framers of the Constitution had in 1787 by protecting the freedoms guaranteed to us through this guardian of our liberties. We urge all citizens to study the Constitution and reflect on the privilege of being an American with all the rights and responsibilities which that privilege involves. It is important to note that the towns of Governor and Morristown in St. Lawrence County are named for Governor Morris, who wrote the preamble of the Constitution. We want to thank you for taking the time from your busy schedules to consider this resolution celebrating America's most important document.
Thank you, Kelly. Moving on to the presentation of resolutions. Mr. Akers.
Mr. Chairman, it is my honor to offer this resolution proclaiming the week of September 17th through the 23rd of 2020 as Constitutional Week. I move this resolution.
Second by Mr. Forsyth, Mr. Sheridan, Mr. Smithers, Mr. Denisha, Mr. Perkins, and Ms. Curran, and Mr. Fay, and Mr. Akers. And Mr. Arquette. Any comments, any questions regarding the resolution? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Denisha.
Thank you, Mr. Chairman. I offer a resolution authorizing the chair to sign a New York State Elections Cybersecurity Remediation Grant for the Board of Elections. Move for
Is there a second? Second by Mr. Perkins and Mr. Arquette. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Denisha.
Mr. Chairman, I offer a resolution modifying the 2020 Board of Elections budget with the acceptance of the Have Cares Act grant. Move for that.
There's a second. By Ms. Curran. Any discussion? Seeing none, roll call, please.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
15 yes.
Resolution is carried. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the chair to sign a geographic information systems hosting agreement extension with the Development Authority of North Country and move for its adoption.
Is there a second? By Mr. Akers, Mr. Forsythe. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Barton and Legislators, PC, to prepare an all hazards, multi-jurisdictional hazard mitigation plan for St. Louis County and move for its adoption.
Is there a second? By Ms. Curran, Mr. Perkins. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the chair to sign a New York State Division of Homeland Security and Emergency Services fiscal year 20 law enforcement terrorism prevention program grant, modifying the 2020 budget for the sheriff's office and move for its adoption.
Is there a second? By Mr. Perkins and Mr. Akers and Ms. Haggard? Any discussion? Roll call, please.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
15 yes.
Resolution is carried. Mr. Denisha.
Mr. Chairman, I offer a resolution accepting a fiscal year 20 Operation Stone Garden Program grant from New York State Division of Homeland Security and modifying the 2020 budget for the sheriff's office and move for its adoption.
Is there a second? By Mr. Perkins, Mr. Forsythe and Mr. Akers and Mr. Reagan. Any discussion? Mr. Reagan.
Mr. Chair, I would just like to thank the Sheriff's Department for its efforts to work with local law enforcement, especially the city of Ogdensburg, to help bring in this money that's so critical to protecting our borders. The city of Ogdensburg is going to receive over $139,000 for the police department through this grant. And I'd just like to commend the sheriff and commend the undersheriff and commend their department for all the work they do with the local departments to make our county a safer place for all of us. So thank you.
Thank you, Mr. Reagan. Anyone else? Seeing none, roll call, please.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
15 yes.
Resolution is carried. Mr. Denisha.
Mr. Chairman, I offer a resolution accepting a 2021 Police Traffic Services grant from the State of New York Governor's Traffic Safety Committee and modifying the 2020 budget for the Sheriff's Office and move for its adoption.
Is there a second? By Mr. Perkins, Mr. Sheridan, Ms. Curran. Any discussion? Roll call, please.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arcot,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
15 yes.
The resolution is carried. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with the New York State Defenders Association for the Public Defender Case Management System, move for its adoption.
Is there a second? Mr. Akers. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Sheridan.
Thank you, Mr. Chairman. I have a resolution authorizing the chair to sign a contract with the New York State Department of Health for the Children with Special Health Care Needs Program Grant, and I move for its adoption.
Is there a second by Ms. Curran and Mr. Perkins? Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Sheridan?
Chairman, I have a resolution authorizing the chair to sign a contract with the New York State Department of Health for the Early Intervention Administration Program for the Public Health Department, and I move for its adoption.
Seconded by Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Sheridan?
Chairman, I have a resolution authorizing the chair to sign contracts with community organizations for services associated with COVID-19 response grant, and I move for its adoption.
Is there a second? By Ms. Curran. Mr. Smithers? Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Sheridan?
Mr. Chairman, I have a resolution authorizing the chair to sign a contract with the New York State Department of Health to accept opioid epidemic grant funding to fight the opioid epidemic in St. Lawrence County, and move for its adoption.
There's a second by Mr. Akers, Mr. Forsythe, Mr. Smithers, Ms. Curran, and Ms. Haggard. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Sheridan?
Chairman, I have a resolution for approval of bad debt write-offs for community services, and I move for its adoption.
Is there a second by Mr. Perkins and Mr. Forsythe? Any discussion? Roll call, please.
Lightfoot,
No.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
No.
Fay,
Yes.
Haggard,
Yes.
Piatto,
Yes.
Burke,
Yes.
Arcot,
Yes.
Terminelli,
Yes.
Curran,
No.
Reagan,
Yes.
Forsythe,
Yes.
12 yes, 3 no.
Resolution is carried. Mr. Sheridan?
Mr. Chairman, I have a resolution authorizing the chair to sign 2 contracts with the New York State Governor's Traffic Safety Committee to accept the Traffic Safety Program and Child Passenger Safety Grants 2020 through 2021, and move for its adoption.
Is there a second by Mr. Denisha and Mr. Smithers? Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Sheridan?
Chairman, I have a resolution amending the St. Lawrence County Youth Advisory Board bylaws and structure, and I move for its adoption.
Is there a second? By Mr. Perkins and Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing the chair to sign an agreement with New York Power Authority for the installation of a culvert on County Route 39 to facilitate the Smart Path Moses Adirondack Transmission Lines project and to modify the 2020 budget for the Department of Highways. I move this resolution.
Is there a second? Ms. Curran, Mr. Sheridan? Any discussion? Mr. Akers?
So I would ask, Mrs. Doyle, was this the resolution that we had previously tabled, that we were waiting for more communication between the Power Authority and Mr. Chambers?
I believe it was nice. Mr. Chairman? Can I answer?
Yes, ma'am.
I believe that it was. I was thinking the same thing as I'm reading that. I'm looking back now to see if that had actually been gone through. I might not want to do that. Let me just look that up if you can.
It's done.
Good done.
Because I believe it's still on the table.
I thought so too.
I think you brought it back up, that they found some way for the. Well, was it, was it
That
tabled?
was left, but I'm checking.
It was tabled until next finance.
Right.
I think it was tabled again, yes.
It was tabled twice.
Yeah. Down is there.
Actually, we had some conversations, emails today from NIPA, and the DEC has still not decided whether they are going to go forward with a project on private property to mitigate this or to move forward with a culvert project. So this is still up in the air as of today.
Keep on the table until September finance.
It's on the table until
Until
September
September
finance. So what do we have to do, withdraw the,
Motion in the second. Yep.
okay.
Our
We,
apologies.
who seconded?
I'll withdraw.
Okay, and the second was
Ms. Curran and Mr.
Ms. Curran? You withdraw your second?
Yes.
Okay. The resolution is withdrawn unless there's an objection. And I see none. Moving to the next resolution, Mr. Akers.
Mr. Chairman, I offer a resolution approving New York State Department of Transportation Supplemental Agreement Number 1 for final design for Browns Bridge Road over the Racket River, bid number 322-1560, bid number 77-5380. I move this resolution.
Is there a second? Mr. Perkins. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2020 budget of the Department of Highways for revenue received from the St. Lawrence County Soil and Water Conservation District for Culver replacement on the County Route 49 in the town of Norfolk. I move this resolution.
Is there a second by Ms. Curran? And Mr. Burke. Any discussion? Mr. Burke.
Once again, I want to take the opportunity to thank Soil and Water for being an excellent partner with St. Lawrence County. It's certainly much appreciated.
Thank you, Mr. Burke. Anyone else? Seeing none, roll call, please.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins.
Yes.
Akers.
Yes.
Fay,
Yes.
Hager,
Yes.
Bianco. Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
15 yes.
The resolution is carried. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2020 budget for the Workforce Innovation Opportunity Act for additional funding. I move this resolution.
Is there a second? By Mr. Smithers and Ms. Curran. Any discussion? Mr. Fay, did you want to second that too? Would you have Mr. Fay the second on that, please? Any further discussion? Seeing none, roll call, please.
Smithers,
Yes.
Tanisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco, Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran. Yes. Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
15 yes.
The resolution is carried. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2020 budget for Workforce Innovation and Opportunity Act for dislocated worker and administration. I move this resolution.
Is there a second by Mr. Perkins? Any discussion? Seeing none, roll call, please.
Tanisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran. Yes. Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
15 yes.
The resolution is carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the inclusion of officers of the St. Lawrence County Fire Training Facility, Inc. as insureds in the St. Lawrence County Workers' Compensation Self-Insurance Plan. I move this resolution.
Seconded by Mr. Denisha and Mr. Smithers and Mr. Forsythe, Mr. Burke. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution establishing a standard workday for New York State retirement system reporting purposes. I move the resolution.
Is there a second? By Mr. Smithers and Mr. Perkins. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution adopting proposed local law B for the year 2020, amending local law D for the year 2018, setting policy on acquisition and sale of tax delinquent property in St. Lawrence County. I move this resolution.
Is there a second by Mr. Forsythe, Ms. Curran? Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Burke.
Mr. Chairman, I offer a resolution authorizing the continuation of the current vacancy review process and filling of vacancies.
Is there a second? By Mr. Forsythe, Ms. Curran, Mr. Perkins, and Ms. Haggard? Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with iWork for a fleet management software system and modifying the 2020 budget for the Department of Highways and Workforce Adoption.
Is there a second? By Mr. Forsythe, Ms. Curran. Any discussion?
Mr. Chairman.
Mr. Denisha.
If Mr. Chambers is still on, or perhaps he could,
Yes.
Mr. Chambers, you offer us a word or two?
Yes. Currently, we have Dossier as our fleet management system, which basically in the past had helped us with the work orders and parts and billings to other departments and agencies within the county, as well as within the Department of Highways as well, managing that and tracking maintenance. That system right now, even though the dossier indicated that they would be able to work on or get our system working in the third quarter of 2020, they have now informed us that their system will not even start working with our new system with United Auto until the second half of 2021. It's imperative that we have a fleet management system in there for parts inventory and management of the shop and facilities for multiple departments. The iWorks program is actually slightly cheaper than the current dossier program. However, there is a one-time setup fee of $2,000 that is necessary. Also within this resolution, we've seen, I'm asking to transfer money within the department, within the existing budget to pay for other software systems such as John Deere, Allison Automatic, Bendix for the brakes on our trucks, and numerous other software costs that we've seen a rise in the last year or so. They tend to be subscription-based now, cloud-based, and with a charge for everyone. So some costs that I didn't anticipate rising to the extent they have in the 2020 budget year.
Any questions for Mr. Chambers? Any comments? Seeing none, roll call, please.
Perkins,
Yes.
Akers,
Yes.
Hay,
Yes.
Hager,
Yes.
Pietro,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
15 yes.
The resolution is carried. Mr. Perkins.
Thank you.
I have a resolution authorizing the chair to sign a contract with the St. Lawrence County Indigent Defenders for 2020 to 2024, and I move for its
Your second. Second by Mr. Akers, Mr. Forsythe, Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Moving now to the county administrator's report.
Well, I wanted to welcome you all back. I believe this is probably one of the latest board meetings that I can recall into the month. But certainly we've had the Labor Day holiday, and typically we would be moving back to the 9 a.m. to 5 p.m. schedule. But I just want to remind you that we are continuing as a result of a contract settlement, continuing with the 8 to 4 schedule. So county offices will be open 8 to 4 year round. Just a few updates for you tonight. Wanted to let you know that the tower projects for emergency services interoperability are continuing. Waddington and Hammond are underway, and Governor is all but finished. I will have Mr. Denner bring you an update. There is one change order expected in Hammond. I'm hopeful we'll have good information for you at operations to give you an update. Also, I did email all of you about attending the Smart Path update meeting. And also a tour, and the poll so far looks like September 29th at 10 a.m. Will be the time to gather. I believe they're going to host us downtown here, but I'll get the details out to everyone so you can plan to attend. I wanted to spend just a moment on the campaign underway by our Youth Bureau Director, Alexa Backus, and the Youth Advisory Board called It's Your Task to Wear a Mask. And what will be upcoming this month for you to see both the work that's been done and also where we're headed with this.
The submission for the mask designs will be accepted until September 22nd, so spread the word. Later this week, Channel 7 will feature an interview with our youth committee chair, a student at Gouverneur School District, and Alexa on Thursday. And in finance, we'll bring you a resolution with the board's consideration to modify the budget so that, should the board approve at the October meeting, we would have funds to put a mask in the hands of all students in the fall with a design chosen by the students. So far, we are receiving some designs in, so we certainly want to put that out there, and we're going to try and communicate better with the schools as their art classes are getting underway in a little bit different where they're doing remote. It'll be a little bit of a different format, but hopeful that we can get lots of submissions for consideration, and the youth committee will be making that determination. So we're hopeful it will be a success. The 2021 budget process is well underway, as you know. And I'm looking for some feedback and on the legislative process that you would prefer this year. There are two options to offer, and certainly I am open to suggestions. We can, in the first instance, continue the process we have undertaken since 2015, where we have the jurisdictional committees after the tentative budget is presented. The jurisdictional committees are the place where questions and answers can be provided by the departments that report. So operations, the departments that report to operations at the end of the agenda. I think just before the county administrators report, we have a 2021 budget session where questions can be answered, expand. I usually bring some highlights of changes to you, and then we move on through services into finance, and then we would schedule, should the board be prepared to move forward with a public hearing at the November meeting on November 2nd, and then a vote on the budget that evening. Going back in time a little further, we also have the option to bring in, and we used to do this, all departments with mostly a Monday, Tuesday schedule for the duration of October and November. So there are 14 dates that we could schedule departments to come in. We would try and schedule a session for those of you that recall before the meeting that begins for the committee. And then on Tuesdays, for example, years past we've done Wednesdays or Thursdays. We would do an early evening session, stop for a dinner break, and then do a later evening session. In that scenario where all departments come through, we could schedule a special board meeting to adopt any changes, November 23rd, and potentially the public hearing and a special board meeting on the 30th of November to consider adopting the budget. So I'm hopeful when I finish my comments that I can take some feedback on that as well, so that we can plan accordingly. I just want to mention that Vacancy Review Committee will be scheduled for tomorrow. We do have 2 legislators that will be joining us. There are 11 positions in 7 departments to be considered. And certainly, as part of the discussion earlier this evening, we'll be talking with Public Health and discuss the options relative to filling their positions. Also wanted to mention to you just for this month, since we are a bit condensed, starting our board meeting on the 14th, at Combined Operations Services next week, you'll be hearing the Emerald Ash Borer update provided to you. You'll also be hearing at services the opioid treatment program presentations provided. We'll also I'll bring back to you the request for the analysis with DSS Legal. And then at finance, the Port Love presentation, folks will be coming in to talk with you. If you remember pre-COVID, there were conversations about the READY project that they've been awarded and a reserve that's set aside by the county since the early 2000s that was intended at that time for the creation of the fort itself. They have some ideas and they're looking to have a conversation with you about potentially repurposing those funds. And then at the October board meeting, you'll receive the 2021 tentative budget presentation. So I did just want to remind you, certainly we'll have conversations with everyone about timely presentations and giving you good information. That's all I have, and I'd love to hear some feedback on budget preference.
Mr. Denisha?
Make it quick. The budget process procedures work well the last 5 years, and I see no reason to change it.
Is there anyone else that wishes to comment on the current way that the budget process is being handled? Mr. Burke?
I don't totally disagree with what Larry said, but I do think at some particular point in time, we should hear from the different departments. their challenges, their successes. I think it's important feedback, and actually the two speakers we had in the public session tonight, it's interesting the information that they share, and I can't help but wonder how much more information our own folks have that would be beneficial to share with us as well. You know, the idea of the Brookfield power and the delving into some of the social issues that underlie opioid addiction and poverty. I think, you know, we certainly, the money part, finances have been stable, have been good, but at some point in time, I think we need to ask and find out just how well we're doing with services, and I think it's an opportunity. And again, it doesn't have to be tied with budget as far as I'm concerned, but I do think that at some point we should have the departments coming in with the focus of telling us what they see as far as needs are concerned, and again, their challenges and some of their successes. I think it's important.
Thank you, Mr. Burke. Anyone else? Mr. Akers.
Well, I think it's fine. It's worked well the last 5 years. I'm hoping that you're going to come in with a presentation of a budget with no tax increase. That's what I'm hoping for. And I think things will go very smooth. We're right now with our fund balance, we're at 11.6% of appropriations. We still need to get to 16.7. That's what the recommendation is. And I believe with the COVID that we're going to have all kinds of challenges ahead of us, and what the state is, what Albany is going to reimburse us and how they change the reimbursement. I think you keep that in mind when you go through the budget and what the citizens can afford.
Thank you, Mr. Akers. Mr. Perkins.
I think the budget has done well the last, since 2015. I'd like to keep it the same.
Anyone else? Mr. Burke, I think that perhaps what you are suggesting could be accomplished at the committee meetings, the operations, the services, and the finance committee meetings, if that would fit into the way that you are thinking about it.
Yeah, I'm fine with that, Joe. I think it doesn't matter what format we use. And again, I don't have an issue with the way the budget has worked, but I do think that there's a lot of information that we could glean by having a dialogue with our department heads.
Okay.
And
Thank you
I'm
very
fine
much.
with that, Joe. I'm fine with
Okay,
that.
thank you. I think you have your answer.
Or any objection to continuing that way?
Any objections to the way it's currently being conducted?
Okay.
None noted.
Thank you.
Thank you. We'll move on to committee reports. Are there any committees that wish to make a report? Mr. Forsythe.
Yeah. The RVRDA made our community development awards last week, I guess it was in Canton, was not. Fourth presentation is going to get $10,000 for shoreline mitigation, part of the READY program. Black Lake Chamber of Commerce has a billboard project, posters for their pan fishing tournament, $5,000. St. Lawrence Art Council is going to get $20,000, and that's the highest award amount. $20,000 is the max. We changed that about 3 years ago. And we also changed the total amount due in any 1 year to $100,000. So this, when I'm done, will add up to $100,000. The Crest Center at SUNY, that's part of the CDL class, It's to help purchase a used tractor trailer for the training of the students taking the CDL course. St. Lawrence County Chamber was awarded, that was $19,800. The St. Lawrence County Chamber was awarded $7,000. They spoke to us last week or last meeting, I think it was, about merging all the chambers. This is to go to the next step, help them go to the next step. Town of Louisville got $18,000, $18,200 to renovate a hockey score box and install dehumidification system. And then the Village of Waddington for the gateway signage was awarded $20,000. So there was, I think, 7 out of 13. A couple of them had gone by. One was the Bassmasters tournament with no money. So there's some good applications this year.
Thank you, Mr. Forsythe. Any questions for Mr. Forsythe? Seeing none, Mr. Smithers.
I did attend the Governor and St. Lawrence County Fair Board meeting on September 1st, and they are going ahead with their planned Pumpkin Festival on Saturday, September 26th, where they have the pumpkin drop and weigh-off contest, and they're having some craft fair vendors, but they plan on doing it in a way so that they control the crowd movement in the buildings rather than having people clumped together. So I'm going to try to monitor that for safety reasons. And 2 food vendors. I am aware that there's another event taking place in Madrid on that day, and if we could try to avoid having similar events on the same day in the future, that would be good. But they are planning on going ahead with that on the 26th. And they also talked about quite a number of boats that are being stored over the winter in the buildings there.
Thank you. Any questions for Mr. Smithers? Seeing none, Mr. Venetian.
Not a question for Mr. Smithers, Mr. Chairman, but my favorite subject, Office for the Aging. We had our meeting today, the advisory board meeting, and just to let everyone know, we have about 700 home delivered meal clients at this point. Our routes have gone from 15 to 19. There are still, it's hard to believe, there's still 50 people that are on the waiting list. There are some, Andrea in Montgomery is looking, and her staff are looking at consolidating meal prep sites to make it more efficient because due to the lack of personnel. They're having difficulty filling vacant spots. People come and interview for a job, and for one reason or another, they decide that they don't want it. So again, this is my plug once again for volunteers. If we have someone that wants to help at one of the meal prep sites, would be wonderful. If we have folks who want to do volunteer delivering meals, that would be great. If anyone is looking for something to do in your spare time, call Andrea, she'll put you to work.
Any questions for Mr. Venetian? I have one for you. Where are these new routes established, if you know?
I do not know exactly where they are. I do know that some of the areas, now we didn't have, there weren't any clients being served in Russell. Now there are 9 additional clients being served in Russell, which is added on to an existing route.
Okay.
But I can't tell you exactly which.
All right. Could we get that information from Andrea and get that out in, the form of an email or something to the legislators so that if it's in their area, they may wish to consider volunteering,
You bet.
myself included. Thank you, Mr. Venetian. Anyone else? Ms. Curran.
We've not met with Fish and Wildlife, but I was kind of summoned to the Messina Town Hall. They wanted to tell me that they're gonna have the big bass blowout that they were planning on having in October on the 2nd and 3rd. They'll be only allowing contestants from within New York State so that they don't go outside of the rules of quarantine. But then they're also looking kind of as a group at the different places that in the small streams and tributaries where the fish normally spawns and have been dammed up by the beaver. They're making a list and they want me to take it back to the Fish and Wildlife thing when we decide to meet again.
Thank you. Anyone else? Mr. Burke.
Just a reminder on the census 2020. We're down to the final stretch. We have just a little over 2 weeks left. And Jason and John from planning have done a wonderful job. But we still need to remind people to complete their census, and you know, that dollars are attached to it and services are attached to it. So if we could get the word out, that would be great.
John, has there been any uptick in the southern townships?
No, the southern portion of the county still is falling way behind. There are townships that have done extremely well, but the southern part of the county is lagging, and I know this. We spoke with the 2 census representatives this past week, and they're placing a lot of resources in that area, and I think that they're sending out another letter as well to try to catch those people and get them counted. But it's been a challenge, and so whatever, if anybody has any thoughts, I mean, again, Jason and John have done an outstanding job. I think the county efforts have been remarkable. I don't know, and the census folks, I think, have done their part as well. But there's many challenges in this this very large county, and the southern part again is a challenge to get people counted there.
Okay, thank you, John.
You're welcome.
Mr. Arquette.
Thank you, Mr. Chairman. I just wanted to let everybody know that the multi-use trail will be closed this coming week for the trail reparations to come into our next season. But I do want to thank our trail coordinator, Deb Christie, along with Joel LaPierre from Governor, the chairman of the Trails Advisory Board, Mr. Chambers, Mr. Button, and all of the volunteers, especially for all the hard work that gets done. I strongly believe that the activities on the trail represented a great contribution to our overall sales tax generation this year. So I appreciate that.
Thank you. Ms. Terminelli.
Thank you. I just wanted to let everybody know that the Franklin County Soil and Water, in partnership with a grant through the EPA, they are having their final draft presentation to the public for the St. Lawrence River Watershed Revitalization Plan, open for public comment before they submit their final findings to the state for publication. If anybody's interested, it's actually a webinar on Wednesday at 6 p.m.
Thank you. Anyone else? I'd just like to let you know that there is a second meeting this Thursday, video conferencing with Franklin County regarding the land claims issue. I'm not at the liberty to discuss any of the strategies or of the outcome of those meetings at this time, but it's a continuing effort at the behest of the federal court to come to some kind of a conclusion to this multi-year, multi-decade back and forth over the land claims issue. So hopefully by month's end, we'll hopefully have some good news. Not great news. I don't expect any money forthcoming, but good news. So thank you. Anyone else? Okay. Any old business? Ms. Haggard.
I'm not sure if this is old or new, but I'm really concerned about the vacancies in the Department of Health, and I'm wondering what we can do to expedite filling those spots given what we're going through right now. And if there's something that we as a board can address to help out there, because it's such a critical department, just like all our departments. But given that the pandemic is going on and that she's taxed with the immunizations and the flu shot and all the other things that are happening with the colleges and trying to keep up with that testing, is there anything we can do as a board to somehow get those 4 positions expedited and filled? Is it a matter of salary or recruitment? I'm asking because I'm concerned about the situation.
I think part of the solution is exactly what will happen tomorrow with that vacancy committee, where Dr. McGuire will be coming in and making her case for filling vacancies. The second part of that is nursing positions. And because of the level of salary, we're having a difficult time bringing in people to apply for the position. That's already been addressed in public. I don't want to go stirring up another hornet's nest, so I won't go any further with that. But those are 2 of the ways that we could take a look at that. If we could change the way that nurses' salaries are computed based on perhaps their experience, time in service, things like that, might go a long way towards bringing in some qualified applicants. County Administrator?
Tonight you've approved 2 of the 4, as well as continued the authorization for me to make part-time hires, which has also been assisting with the medical leaves and backfilling those vacant spots. While there are still people employed, they just can't be at work right now. So I think tomorrow that gives an opportunity for the vacancy committee to hear the ideas. Certainly Dana and her team know best where those gaps exist and how best to fill them. I think that allows us next week at services to hear in the vacancy portion of the meeting. And if possible, I'm certain the board would entertain a special board meeting to accelerate that ahead of finance if necessary. If there are folks, we have been able to move pretty quickly, but we've also, even in the part-time arena, seen folks depart, whether it is salary related or not. We also will have on Thursday this week a labor management meeting with the union, and that will be one of the topics of discussion. So I think by this time next week, we'll have an opportunity to fill you in on at least those 2 meetings and any work that happens in between.
Okay. Another follow-up, Ms. Haggard? Go ahead.
Yes, please. Thank you, Mr. Chairman. Can we also maintain some sort of flexibility in, she expressed that she wasn't sure right now what the needs were going to be and not able to predict, but is there a system by which we can remain flexible and expedite any additional staff she might need to meet the requirement going forward in her department? Thank you.
So one of the things you may recall seeing in one of the vacancies was 3 titles in one of the positions. So I believe they were nurse, service coordinator, or public health specialist.
So there are a variety of types of positions, depending on the applicants, that we asked the board and the vacancy committee prior to that to allow her the opportunity to hire the best fit or the best candidate, depending on the criteria that they fit. That did work, and that gave her the flexibility, and she was able to, as you just approved, I believe, narrow that down to the public health specialist. So it has a variety of backgrounds. I think what you'll also hear her say is not always is a nurse required, but in some of the job specifications, they're a nurse or other criteria that would qualify them for the position. So I think the board has, much like last year or 2 years ago now, you may recall community services bringing forward either a social worker or a mental health counselor. Depending on the applicant pool, by the time it makes it to the board, they're able to advertise ahead of time to get some applicants in the pool. They're also able then to make that fit, and when the board ultimately approves, they've narrowed it down to the best candidate. So I think those are helpful tools that the board has employed, and I'm certain that she would ask for that again.
Thank you. Mr. Burke.
Thank you.
Just a follow-up to Margaret's comments. For those positions that require a registered nurse, they have traveling nurse companies that provide that, much like we're using with community services. We're contracting, I believe, a locum tenens for psychiatry services. At least I believe we are, Ruth. Maybe you could comment on that. But there are services out there that that will get you the title that you need, and again, hopefully on a short-term basis until we can recruit and fill permanently.
Thank you. Anyone else under old business? Mr. Fay.
I'd just like to make a couple comments on
Microphone.
It might not be working.
The mics aren't working.
Oh, okay.
Here, I'll go right.
older business stuff. Tonight, probably the citizens' comments were the best I've ever heard from the time I was on the board in the 80s until today. In today's presentations, where we talked about basically what we could do with our police, and we talked about what we could do with the Brookville. To give you an example, we passed a resolution where we're going to protect all prime farmland in this county. The planning board meeting this past week, which a resolution we passed in 3 minutes. We spent 3 hours basically going through 5 projects, of which 4 were on prime farmland, which were approved. The only one that wasn't approved was from Rock Island Road in Governor, so you could proceed. I mean, as far as it wasn't on prime farmland, it still was approved. You can tell by just the name of it why. Basically, they found a spot that wasn't prime farmland that basically could be one. So I think that sometimes when we have these citizens' comments and things that come out of committee, we have to have more follow-up, especially when we're looking at assessments on power dams for water, where 5 towns, I believe, they said were going to be affected. So we listened to it tonight, but can we as a board support these towns when their defense against people that are challenging their assessments? So I just want to add that as a comment tonight. I think that we sometimes have to follow up somehow these citizens' comments which they're making, and stuff like a resolution we passed for farmland we're going to protect. And it seems like that when a presentation is made by a solar company in the community thinks about dollars, or at the same time justifying that this prime farmland is the only place they can build this solar panels is very questionable. So I'd just like to add those points to think that I think these are things we got to think about a little more closely. And I'd like to comment on and praise basically 2 presentations that were made by citizens tonight. I thought they were well thought out and well presented.
Thank you, Mr. Fay. Any questions of Mr. Fay? Mr. Burke.
Just as a follow-up, I think what Danny said is spot on. As a follow-up, I'm wondering if we could ask our county attorney to reach out to those townships and offer support to to help them fight that court battle.
Mr. Burke, it's funny that you mentioned it because the attorneys reached out to me today and asked me if I would be willing to assist them. So it's something I intend to address with you later on this evening.
Okay.
Any other old business? Any new business? Mr. Perkins?
I guess we've been talking about it, but it is new business, these dams. It doesn't just affect the townships, it affects the county as well. It's assessed value 50% in these 4 townships. That's a considerable amount of money, and I think we need to put our efforts into this. I'm gonna ask the county attorney what we can do to go forward to help the towns and the county's position.
Okay, thank you. And I think you'll find most of us agree with that. Any other old or new business? Seeing none, we have need for executive session for litigation, negotiations, appointments, personnel also, and personnel. Motion by Mr. Forsythe to go into executive session, seconded by Mr. Sheridan and Mr. Smithers. Any discussion? All in favor?
Aye.
Opposed? Carried. We are now in executive session.
Mr. Chairman, I offer the reappointment to the Environmental Management Council. The terms to expire September 30th, 2022. Ryan Burkham, Norwood, New York, and Richard Marshall, Messina, New York.
Is there a second? By Mr. Forsythe and Miss, what's your name again? Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Sheridan.
Mr. Chairman, I offer for the Youth Advisory Board term to expire August 3rd, 2022, the appointment of Amber Sullivan of County Route 14, Madrid.
Is there a second? By Mr. Smithers, Mr. Denisha, and Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. I have one appointment, Mr. Sheridan to Chairman of the St. Lawrence County Highway Committee, replacing Mr. Denisha. Is there any other business to come before?
Mr. Chairman, I have a resolution, and the resolution is authorizing the chair to sign the contracts to provide immunizations for the Public Health Department. I move this resolution.
Is there a second by Mr. Forsythe? Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried.